It's not always an infection. Sometimes pelvic floor tension is behind that itchiness that you're having. Pelvic floor tightness and nerve irritation can mimic other conditions. You got to be aware of that. That tension, that itchiness that you're feeling is as a result of irritation of certain nerves. So nerve compression or irritation can play that role. Sometimes it's related to the muscle tone, and that is causing that irritation of certain areas and impacting the blood flow to the area. So there are certain things that you got to be aware of. A lot of times we try to blame one thing, and here I am telling you this, and I'm going to blame one thing, but it's not one specific thing that you go fix that and then it's all done. You got to understand some of the basic anatomy and functionality or biomechanics of the region. There are nerves that come from your spine that's connected to your pelvis, and your legs are connected to the pelvis as well. When you irritate the nerves that are in this region, some of those nerves go through, this yellow line is an example of that, go through the inside with all the goodies that are on the inside, and they come to the surface of the perineum, genitalia, so that could be penis or vagina, and your anus. Sometimes itchiness happens on the surface, sometimes it feels like it's on the inside. This itchiness that you're referring to, in the absence of infection or dermatological issue, is because of pelvic floor dysfunction. The muscles on the inside that house or that cover the whole inside of your pelvis work with the outside environment to try to stabilize the pelvis. When the stability is compromised and is not happening, it can be from issues related to the stability of the pelvis itself, or something that has to do with the connection of the spine or lower extremities to the pelvis. When that happens, the muscles on the inside have to work a lot harder to try to minimize the amount of instability. When they get tighter, anything that resides here can be impacted by this change of environment. We're talking about intestine, prostate, uterus, ovaries, bladder, muscles, joints, ligaments, arteries, nerves, and veins. So all of the things that I mentioned to you can show manifestation of this lack of stability in your pelvis. So nerve compression can lead to itchiness. Decreased blood flow can cause that. Increased muscle tone, or muscle tension, I should say, can lead to that. So first you find out that you don't have any infection, you don't have any issues. It's not, you may, as a man, you may be told that you have prostatitis, inflammation of the prostate. You happen to also have constipation, but you didn't think that was related to the pelvis. You also may have dribbling, but it's not bad enough, so you didn't even think about it. But when it involved to your sexual performance, now you're like, okay, something is wrong. I need help. Or it involved your penis. Something is wrong. So the reality is, in the absence of infection, we think of infection or dermatological issues. We're thinking of nerve compression, irritation, muscle tension, blood flow issue. It's very, very important for you to understand that pelvic floor dysfunction comes in many shapes and forms. It's the name of a chapter of a book with many chapters. If you have chronic lower back pain, if you have chronic sacroiliac joint pain, if you have chronic hip mobility thing, if you're sucking your tummy in, or you're sucking your breath, or holding your breath, if you have a poor posture, you have pelvic floor dysfunction, and you can have these symptoms. There's so many other presentations. I've done so many videos. If you have not subscribed to my channel, make sure you do, because you'll see how pelvic floor dysfunction can show up in your world, and has been showing up. You just did not realize it. You know, we live in a society where they chop you into pieces, and each piece is given to a different specialist, and apparently no one talks to each other. So you may be seeing a chiropractor or a physical therapist for your back pain. You might be seeing a urologist for enlarged prostate or bladder issues. You may be seeing a GI doctor for your constipation and everything else, and all of these were different manifestations of pelvic floor dysfunction, pelvic instability. I hope this made sense to you. I hope you found this helpful. Please make sure that you comment and you make any suggestions you have for any future videos. And if you have, or if you need any help, contact my office using one of the methods of contact in the description box. And until next time, take care.